My book, The Waxman Report, How Congress Really Works, is a book about different legislative issues that I've been involved in successfully, and how the laws that resulted from those legislative fights have been very, very successful, benefited in many cases millions of people, and then oftentimes people don't realize that it was a struggle to get the laws through, and they take it for granted after it's already in place. And I think it's important for people to understand that government can play a fundamentally important role in giving people opportunities, protecting consumers, and making life better for more people. The bill that we passed through the House and we're waiting for the Senate to act on is an energy and climate change bill. It has three important objectives. We want to reduce the carbon emissions that are causing greenhouse gas problems that threaten our planet. And we're worried, as scientists are telling us, that we may reach a point where the damage will be irreversible. But in accomplishing that goal, we think we can provide a kickstart for the economy and provide millions of new jobs as we develop technologies to reduce carbon and change the way we use energy to make it more efficient and to make us less dependent, which is the third objective, on having to bring in imported oil. So much of our oil is imported from countries, especially the OPEC countries, that do not wish our country well. And we are transferring wealth to them. We don't buy oil from Iran, but when we buy on the world market, Iran sells oil to others, and they have billions and billions of dollars that they're using to develop their nuclear weapons. And that's something the United States is trying to stop because of the threat it will be to Israel and the proliferation that it will result in the Middle East. Well, I'm sorry the Senate hasn't acted yet, but I think they will next year. They have given a lot of attention to the health bill, which I also care a lot about, as one of the authors of the House recently passed health legislation. But next year we'll get on to this legislation, especially after we find that as a result of the Copenhagen conference, bringing the world leaders together to do something about global warming, that we have to be leaders ourselves and pass legislation not for other countries but for our own well-being that will move our energy away from dependent on other countries and reducing the carbon emissions. Well, we'll see what will happen in Copenhagen. I don't think we will get a binding treaty in detail, but I hope that the world community will get to a point where we spell out what we need to do, and then the countries of the world that must work together will help accomplish these goals. It's rare in the history of mankind that countries work together in their self-interest, but this is an issue that affects the whole world. And we can reduce the emissions in the United States, and that will play an important role, especially establishing us as leaders and developing the technology we can sell around the world. But we can't do it all alone. Unfortunately, for the last 8 years, the Bush administration refused to even recognize there was a problem of global warming and energy change, and denied the existence of the problem, didn't show any leadership. Other countries hid behind that and said the United States is not doing anything, they don't have to do anything. We need to be leaders, and hopefully in Copenhagen we can establish our willingness and determination to work with others and to do our own job in the United States to reduce the carbon emissions that are going to cause more damage to our environment. I think President Obama has been a real leader in the area of the environment as well as other areas. And it wouldn't be without his establishing this issue as one that he wants us to work hard on and get something done, that we'd have a chance to get anything passed. He has established what he thinks our goals should be. We're working on it in the Congress, and I hope that next year we'll have a bill that he will sign into law, and we wouldn't be at that position if it weren't for the leadership that he has given to this very important issue. Well, the House has passed our bill, the Senate has to pass its bill, and then we're going to have to work out our differences because it has to be one bill that both houses will adopt so the president can sign it and pass it into law. We'll work out our differences. But what we need is the Senate to act, and I hope they will do that very soon because we must get this job done, as far as I'm concerned, by the end of the year. Certainly we could go into next year, but there are going to be so many other pressures next year, especially with the elections looming, that this is our opportunity. With a new president who's put this issue high on the agenda, there's only a limited time to act. When the Clinton administration tried to do it, they pushed it off into the second year, and the closer it got to the election, the special interests were able to bring it down. This year, with President Obama putting his administration on the line on this question of getting health care for millions of Americans who are uninsured and doing something to hold down the cost, do something about a system that is unsustainable, that costs too much, and that's going to adversely affect every American. I think we're going to get a bill passed. It may not be everything that I'd want, but if we get it in place, we can build on it later, and we could start down the road of making sure that we have a system that makes sense. And someday people will say, why did it take so long for the United States to act? We spend more money on health care in the United States than any other country in the world. And despite that, we have 45 million plus people without insurance coverage. And the cost for those who have insurance is rising so rapidly that many people will no longer continue to be able to afford it. We're not going to be able to pay for Medicare and Medicaid if the government has to keep paying for those additional costs. And if we don't have a system and the ability to hold down costs in the system, we're going to be seeing Medicare pushed down and squeezed, where a lot of seniors will see the promise of health care in their golden years deteriorate. I think the public option has a lot going for it because it provides for competition with private insurance. And that's why I support it. And I hope we'll be able to hold it in the Senate and in the final agreement. And we'll do the best we can.